Right, be honest with me. When was the last time you looked at your breasts in the mirror? And I mean really looked, not a quick glance in the mirror after a shower. Do you do it every time you check your breasts? Do you even know how to? Let's be honest. We're not told how to examine our breasts at school or by our doctors. Mum didn't tell me how to do it. I only learned at medical school. So why is any of this important? If you don't look in the mirror, you might miss an early sign of breast cancer, and the earlier it's caught, the better your chance of survival. I'm Dr. Liz O'Riordan, and I'm a breast surgeon who's had breast cancer, and I've seen so many videos giving you bad advice. So today, I'm going to tell you what you need to look for, and if you stay till the end, I'll tell you the 3 biggest mistakes women make when they're checking their breasts. And remember, men can get breast cancer too, so if you know one, make sure they check themselves as well. Right, you're in front of the mirror, topless. First, I'm going to tell you what to do, and then I'm going to tell you what to look for. So what do you do in front of the mirror? Well, first, you're going to stand with your hands by your side, and if you've taken your bra off, look at the inside of the cups. Is there any discharge there? What colour is it? Now, I want you to look at your breasts. Do they look the same? Many women think their breasts are identical, but they're actually sisters, not twins. One is always a bit bigger, maybe the nipple sits a bit lower, and it's completely normal for one breast to be a whole cup size bigger than the other, and for your one nipple to be 5 centimetres lower. If you don't know what's normal for you, it'll be harder to tell if something has changed. Now, if you've got large breasts, lift them up so you can see the skin underneath the breast. Are your nipples inverted, meaning do they naturally poke in? That's normal too. Next, I want you to put your hands on your hips and push in. And what this does is tense your pectoral muscles, the muscles underneath your breasts. And look at your breasts again. Finally, as long as you don't have any shoulder pain, I want you to lift your arms into the air and look at your breasts for a 3rd time. It should take less than a minute in total, but it's really important to do this. Now, although some women with breast cancer won't be able to see anything and will only feel a lump when they're lying down to check, some of you will notice a change before you feel a lump. And if this has been useful, remember to subscribe so you don't miss my next video. Right, now I'm going to talk you through the changes you should be looking for. Let's start with your breasts. There are 4 things that you need to look for. Number 1 is a dimple or a puckering of the breast skin. Now, you may only see this when you put your hands on your hips or you lift your arms up, and it can be one of the earliest signs of breast cancer. Your breast tissue is connected to your chest wall by strands of connective tissue that run through to the skin. As a breast cancer grows, it constricts these strands, meaning that when the breast tissue is stretched, like putting your hands in the air, or when the chest wall muscles are tensed, like when you put your hands on your hips, that breast tissue is fixed in that spot. And that's why you see a dimple or a puckering in the skin, like someone, I'll show you, pinching in the material because that breast tissue is stuck. And that could be a really early sign of breast cancer. So now you know why I'm getting you to do your aerobics in the mirror. Number 2, a lump. Now, this is what I saw when I looked in the mirror back in 2015 when I was first diagnosed, and a couple of months ago when I had my 2nd local recurrence. And I swear I didn't see those lumps the day before. You see, most breast cancers grow really slowly and they keep doubling in size until one day they are big enough to see and feel. A bit like a woman who is pregnant and suddenly her bump starts to show. You may see an obvious lump with your hands by your side, but it might only show when you move your arms around, and that's why the aerobics is so important. Number 3, a change in breast size or shape. Now, for some of you, it's normal for your breasts to get bigger and smaller with your menstrual cycle. But if you suddenly notice that one breast is bigger than the other, or it's a different shape, that could be a sign of breast cancer. So it's really important to get that checked out. And finally, number 4, skin changes. Now, your breast skin can become red and swollen with a simple infection like an abscess or mastitis if you're breastfeeding. You might have eczema on your breast or get an allergic reaction to a washing powder. But skin changes can also be a sign of breast cancer, particularly inflammatory breast cancer. And that's when the lymph vessels in the skin are flooded with breast cancer cells and they can cause changes. The skin can become red, hot and swollen, or it can look like cellulite or an orange peel. We actually call it peau d'orange. And that's why any skin changes in the breast need to be checked out. Now you've looked at the breasts, we're going to look at the nipples. And there are 3 things that you need to look for. And number 1, nipple discharge. This is completely normal. Think of it a bit like snot. Your nipples have lots of small holes that are connected to the milk ducts in your breasts, and just like your nose, the cells in those ducts produce secretions, and these can build up. And the colour of the secretions can change depending on the natural bacteria in your skin. Just as your snot can be cream or yellow or green in colour, so can nipple discharge, and it's completely normal. And if you have this discharge, don't squeeze your nipples, it just encourages them to make more. However, if the discharge is crystal clear, like water, or it's bloody, it could be a sign of breast cancer. So that needs to be checked out. And that's why it's important to look at the inside of your bra when you take it off, and also your nightie or your pyjamas, as the only clue might be a couple of spots on your clothes. Number 2 is nipple inversion. So some women naturally have nipples that stick in, called inverted nipples. Some have nipples that naturally stick out, and some, like me, have one of each. It's all completely normal. If your nipples are inverted, you should be able to pull them out, and they should stick up when you're cold or aroused. What isn't normal is a nipple that has suddenly become inverted and you can't pull it out. It's stuck. And that can happen if there's a breast cancer behind the nipple that's tethering it, like I described earlier with a skin dimple. If that happens to you, you need to get it checked out. And number 3, it's a nipple rash. Nipple rashes are common, again, with things like eczema or an allergy to your washing powder. But some rashes are actually a type of breast cancer called Paget's disease, where the skin of the nipple is slowly destroyed by cancerous cells. So if you notice a new rash on your nipple, you need to get it checked out just in case. And finally, you need to look at your armpits when you have your hands in the air. You might notice a new lump or swelling that hasn't been there before. Now, this could simply be an enlarged lymph node, and there are lots of reasons why that might happen, such as a bad chest infection. But it could be due to something more serious, like a breast cancer or a blood cancer. So, again, if you do notice a lump in your armpit, get it checked out. And remember, if you're still having periods, do it in the middle of your menstrual cycle when your breasts are less lumpy and sore. And now for the bonus section. What are the 3 biggest mistakes women make when checking their breasts? Number 1, not looking in the mirror. But now you know what to do, and you're going to promise me that you will look in the mirror every time you check yourself. But seriously, these are the 3 mistakes that every woman makes. Number 1, digging in with your fingertips. If you do this, then your breasts will feel full of lumps, because breast tissue is like a mixture of sweet corn and jelly. It's naturally lumpy, especially when you're young, and especially in the upper outer quadrant near your armpit. Normal ridges of breast tissue are felt going out from the nipple to the armpit. When you feel them, it can be really scary. And then you feel the ribs underneath the breast tissue and you can start to panic. I know, I've been there. Instead, you need to feel your breasts like a breast surgeon does, and you use the flat of your fingers and you firmly push your breast tissue against your rib cage to see if you can feel a lump. No more digging. Now, number 2, you should be lying at about 30 degrees. So like this, either lying on a couple of pillows or lying back in the bath. The only people who can get away with doing it standing up are men and women with small breasts that don't droop. There's no nice way to say drooping. The technical term is ptosis, but you know what I mean. If you have large breasts and you feel them standing up, the breast tissue is doubled up, and that means it's much harder to feel a lump in the lower half of your breast. By lying back, your breast tissue is lifted onto your chest wall, where it's much easier to feel. And if your breasts are particularly large, you might need to roll onto your side, and that just helps lift that breast tissue onto the chest wall so it's easier to feel. And the 3rd biggest mistake that you often see in videos online is don't examine your armpit with your hand in the air. Now, why do I say that? When your hand is in the air, your armpit skin is stretched and it's tense, and there's no way you're going to feel lymph nodes deep inside. You need your armpit to be relaxed. So, rest your hand on the opposite shoulder and feel with the other hand, starting at the level of your hairline and moving your hand up. And you're pushing in with the flat of your hand to see if you can feel any enlarged lymph nodes like small marbles. If you want to watch my video showing you how to check your breasts properly, just like a breast surgeon does, check out the video showing now on the screen. I'm Dr. Liz O'Riordan, and thanks for watching.